In the modules till now, we have been discussing what is music therapy, the history, and what are its benefits. In this module, we will particularly discuss about music therapy for palliative care. Palliative care is a very important care for clients, for patients, and music therapy has been found to be effective for them too. As a music therapy profession has developed internationally over the last 25 years, so has its role in palliative care. The palliative care unit is an emotionally challenging place where patients and their caregivers may feel at a loss. Music can allow the expression of these complex feelings. Music is a highly versatile and dynamic psychotherapeutic modality, lending itself to a variety of music therapy techniques used to benefit both those living with life-threatening illnesses and as well as the family members and their caregivers. The views of music therapy for palliative care. When we are working with persons for whom a medical cure is no longer possible, music therapy can improve the quality of life by addressing the emotional, spiritual, physical needs that may arise during that time. Music therapy, as we know, is an evidence-based treatment. Music therapy experiences may include listening, singing, playing an instrument, or composing music. Musical skills or talents are not required for this participation in music therapy. Music therapy may help you psychologically, emotionally, physically, spiritually, cognitively, as well as socially. Now, who benefits from music therapy? Music therapy provides most benefit to patients who lack social interaction or sensory stimulation, experience pain and symptoms that are difficult to control through traditional medical interventions, those who feel anxious or affected by dementia, look for a concrete way to cope or define or articulate feelings or their thoughts, those who face communication problems due to physical or intellectual impairments, those who are in need for spiritual support, possibly involving other family members, those who enjoy music to enhance their quality of life and also maintain dignity. Now, what does a music therapist actually do? The music therapist talk with you about any background you might have in music and your musical preferences. They will then work with you to identify the goals and design an appropriate music therapy experience for the session, and in doing so, they will consider your music preferences and interest, your age and developmental level, your physical abilities, your cognitive abilities, your trauma triggers. Remember, music is medicine for the body and the soul. Music is the civil manner simply, but it is recognized by many doctors on various specialties as a weapon against stress and an additional therapeutic tool for a number of diseases. And no, rightly said, the sound therapy. Music therapy and palliative care. Music therapists interact with and invite palliative care patients and their significant family members and friends to explore how creative music-based experiences in therapeutic relationships can address biopsychosocial needs and enhance spiritual well-being. The music therapist can extend music's power to help patients across the lifespan live a quality of life and support their families. Patients often choose familiar music to listen to, sing or play that elicits people's, places, emotions and thoughts that they want to connect with. Through music therapy, songwriting and improvisation, patients and families creatively explore their so-called playful, musical, and unique selves and potentially experience helpful new awareness, wonder, pride, and accomplishments. So it is not just about pain management, getting better with the after effects of the treatment that they are taking, but it also is looking into a lot of self-awareness and self-learning within the patients and the caregivers too. Patients' song composition legacies can also support the bereaved. Music therapists often guided music and relaxation or imagery interventions. They are used to soothe and help with symptom management. Allowing the terminally ill people to program the soundtrack to their last days can be therapeutic for those nearing the end of their life. And that is where music therapy becomes important for the terminally ill people. Music won't improve their dying prognosis, but it can provide a positive distraction for the patient and help them to relax. Music therapists use music as a treatment tool to decrease a patient's anxiety and conjecture happy memories for them. Many clinical workers who treat terminally or gravely ill people believe that whether it's live or recorded, music can help lower the heart rate and blood pressure of the agitated patients. Patients become less agitated and become more in sync with their ventilator when the music is playing. Research too suggests that music therapy helps dying and the severely ill or injured patients relax. Listening to music before, during and after surgery was beneficial to patients and significantly reduced their pain, anxiety, and the need for pain medication, according to a meta-analysis which was done on the 72 clinical trials published in 2015 in the Lancet. Music therapy is effective in promoting relaxation for the terminally ill patients undergoing palliative care, specialized medical treatment for people for serious illnesses or conditions that focus on providing relief for symptoms and stress. For the terminally ill persons, music therapy can serve as a catalyst to establish both verbal and nonverbal communication. These skills use of music can facilitate emotions, self-expression, and provide a supportive and non-threatening environment with opportunities to confront their fears and discuss their present concerns. Musical associations can facilitate life review and assist in resolving significant personal issues. Music therapy is also seen to help to lessen feelings of isolation and loneliness for providing opportunities for social interaction and the sharing of personal experiences with others. The use of religious music can provide spiritual comfort and reassurance and support to the individual's faith. Music therapy can also be used to help the family members throughout the grieving process by providing them some comfort, continuity, and opportunities to express their feelings of loss. Self-care with music is also possible, and many people indulge in that. Studies show that in palliative care, the music therapy can help to elevate the fears and anxieties, reinforce identity and self-concept, and decrease the feeling of isolation. Encourage the participation in physical activity and exercise to promote feelings of vitality and well-being, which is very important for the palliative care patients. Help to initiate communication with family members, serving as a source of comfort throughout the grieving process, decrease the perception of pain and the length of severity of the side effects of the medical as well as the chemotherapy which they are undergoing. It also helps in aiding the process of life review, which people do when they are towards their end life or when they find less meaning in life. They also provide opportunities to express emotions in a non-threatening and accepting environment. They promote relaxation and elevate insomnia. Efficacy of music, if we look into it, music has been found to have a significant impact on reducing the perception of physical pain and the length and severity of chemotherapy-induced nausea and vomiting. Carefully selected music can facilitate relaxation and elevate anxiety, agitation, and insomnia, and it can provide motivation for physical activation and enhance feelings of well-being. Music therapy can also assist the individual in maintaining a sense of independence and in retaining a sense of control of his or her life by providing opportunities for choice and decision making, which is often taken away from a patient. Research studies that although music is benefiting the patients, it sometimes reminds them of their altered state also. The difficulties experienced by patients during the experience were also related to physical exhaustion. Additional studies are needed to determine the benefits of music for patients and their families in the palliative care unit. So yes, where there are not many benefits, we need to see that it is not being overdone. Music therapy has been successful for over 30 years as part of the palliative care program for the severely ill patients. There is nonetheless a lack of high-quality studies that would enable an evidence-based evaluation and its psychological and physiological effects. So a lot still needs to be done when it's come to evidence-based researches on the effect of music therapy on palliative care. We have music games. As we discussed earlier, that we also have, you can say, a brain for music. And we see that there are different areas of the brain which are tuned to different aspects of music. By triggering parts of the brain, that particular brain, we can incite that kind of a particular energy, which can then lead to better learning and experiences during the music therapy also, and enhancing the music experiences of the patients undergoing music therapy. So this is the diagram which shows where brain is there, where music can help reduce the perception of pain, which area is there which alters the patterns of pain, which occupies the mind, and where the meditative states which are there, which if you are going into deep sleep music, they can be triggered and enhanced. We have the feel-good chemicals which come out from this part of the brain, and if activated, that would lead to an enhanced experiences. So we have here the music acts as a distractor, which is there. So these are the locations of the functional regions in the brain which are involved in processing. So each and every part of the brain is related to some kind of music which is there, which we'll be doing in the next module, where it talks about ragas, and that is where the activation of the brain can be done with the help of activating a particular kind of music, the tone, the rhythm, which all works together in enhancing the feeling of well-being when we are either singing, listening, or participating to various other music modalities. The next part is that on ragas and health. The realm of raga therapy, the melodies and the rhythms of Indian classical music are akin to the palette of emotions, each shade carefully crafted to evoke specific feelings and states of mind. Just as a skilled artist selects colors to convey a particular mood, Indian classical musicians use rags to play in emotional landscape. Now let's delve into some of the renowned rags and their therapeutic effects. So it has been established, scientifically established, how some ragas are related to some moods, some emotions, and how we can use this for as a treatment modality. Now here is a list of rags and their effects on the health. For example, the Bhairavi, it provides relief from cold, sinus, toothache, and backache. The Shivanjani is there for treatment of memory-related problems. The Todi and the others reduce blood pressure. So here, each and every raga has been carefully listed out, identified with their associated effect on a person's health. We have Carnatic music, which is one of the oldest musics which are present, and there are the related terminologies which are there with that, each having their own specific way of presentation and each having a specific effect. Here we list how each and every rag is leading to a particular health benefit. The Bhairavi, often associated with early morning hours, is known for its tranquil and meditative qualities. This rag is believed to create an atmosphere of calm, helping reduce anxiety, stress, and promoting peaceful state of mind. It slows the tempo and soothes the notes, make it an ideal choice for relaxation and introspection. So all those who have been doing the therapy or have been going to certain treatment centers, you will always find music being played in the background, and it is just not there for the ambience creation, but it is there as a therapeutic intervention. Yag Raman is there for uplifting joy. Yaman is celebrated for its ability to evoke the feelings of joy, positivity, and optimism. This rag, the bright and exuberant notes, have the power to elevate moods and infuse energy. Yaman is often employed to promote a sense of well-being, making it a favorite choice for celebrations and festivals. We have Rag Todi, which is deep contemplation. Todi is characterized by its somber and introspective mood. It is known to evoke a sense of introspection and contemplation. Todi intricate patterns of notes have a calming effect on the mind and can help individuals delve into their thoughts and emotions with more clarity. The Rag Malkunas, it leads to the inner stillness. Malkons is associated with the late night hours and is known for its deep sleep, contemplative quality. It has the power to induce a state of inner stillness and reflection. Malkons' melancholic notes can lead to a sense of emotional release and catharsis. So see how each and every rag is so psychologically related and helps us in each and every situation, and their timing of each rag is also such that we can associate and help in our different activities. Rag Darbari, it is there for tranquil majesty. Darbari, often performed during the night, exudes a sense of grandeur and majesty. Its slow, deliberate progression of notes can induce a state of deep relaxation and tranquility. Darbari's regal notes evoke a sense of spaciousness and inner peace. These are some of the references which are listed, which can be looked up, and from where we have taken our references. So, ending on a sweet note, it is for music, because music here is helping us with many of our problems. So, a note to dear music: thank you for always clearing my head, healing my heart, and uplifting my spirits. Thank you.